Hi, my name is Sophie Harding and I'm an advanced oncology pharmacist at Fferylliaeth Cancer Centre in Cardiff. I've trained as a pharmacist independent prescriber in 2010, so about 12 years ago, and since then I've prescribed for patients with breast, lung and gynae cancers. There have been rapid developments in cancer treatments over recent years, and more treatments are becoming available which have been found to be effective in patients who have a cancer which has been identified to have a specific genetic mutation. Genomics affects my practice when practicing as a pharmacist prescriber, prescribing cancer treatments and counselling and educating patients on their medicines. I'm also responsible for checking the results of genomic and pharmacogenomic tests when clinically checking prescriptions for patients prior to dispensing and issuing to patients. Following my involvement in the DPYD pilot project at Fferylliaeth Cancer Centre in 2020, I started to become very aware and excited about genomics and how it will impact future healthcare, as well as my own role as a pharmacist. From this, I developed an impetus to gain a greater understanding of the rapid developments in genomics and how it affects and will affect patient care in the future. In specialist areas such as within the management of cancer, HIV and monogenic diabetes, genomics already has an impact on the role of the pharmacist, as genetic test results are reviewed by pharmacists when they are consenting and prescribing treatments for patients within their prescribing role, and also when clinically checking prescriptions prior to dispensing and issuing medicines to patients. Pharmacists across all sectors of healthcare will be needed on the front line to support the implementation of genomics into healthcare, including the spread of genomics education and training to patients and the public. Pharmacists are also already focused on ensuring a high level of patient safety is in place related to medicines, and often already lead on developing robust clinical governance documents within healthcare organisations. Therefore, pharmacists' expertise and experience will be key when working collaboratively to embed genomic testing into clinical treatment pathways. It's absolutely essential that all pharmacists develop an understanding of genomics, because pharmacists are key professionals on the front line of healthcare who have a big impact on patient care and a significant role in optimising patients' medicines. Pharmacists and medicines experts with a background in scientific training who often advise on drug interactions and the safe prescribing, handling and administration of medicines. The pharmacy profession as a whole has to be prepared and appropriately trained for the rapid advancements in genomics related to medicines use, especially regarding the implementation of clinical pharmacogenomics, which is the reason why the RPS are focusing their programme of work around pharmacogenomics. Pharmacogenomics is defined as how an individual's genetic information determines how an individual manages and responds to medicines, and is one aspect of genomics which will have a significant impact on the day-to-day practice of all pharmacists and pharmacy technicians in the very near future, especially within primary care, as it's already done so in other countries around the world. In the Netherlands and the USA, the pharmacy workforce provides advice on when to offer pharmacogenomic tests, and in some countries offer pharmacogenomic tests in the community setting. They support the interpretation of genetic test results. They're involved in tailoring patients' treatments and counselling patients on these changes to their medicines. So in healthcare, we're moving away from a one-size-fits-all approach to treatment, which has been replaced by a better tailored approach where a patient's medicines can be optimised. Pharmacogenomics helps to determine how a patient will respond to a certain drug and tells us whether the dose prescribed needs to be personalised for that particular patient, or whether the drug needs to be avoided completely in order to reduce the risk of the patient experiencing serious side effects from their treatment. Pharmacists are key professionals working on the front line within healthcare due to their unique training in science and medicines, and they'd be best placed to discuss and explain complex medicines issues related to pharmacogenomics in a patient-friendly way, and this would improve patients' understanding of this new approach to healthcare. Currently, the Health Education England Genomics Survey has been distributed by GPW across Wales for our involvement as pharmacy staff. Please complete the survey to enable us to establish the needs for pharmacists and pharmacy teams with regards to genomics.